So I'm going to share my screen. Hello, everyone. How are you? How are you? Thanks for joining us. We're going to have a fun presentation, and it's going to be all about you and how to become seizure-free and best practices. But the presentation is called Path to Seizure Freedom. So I'm going to share my screen now. And let's see, right here. Tell me if you can see it. Okay.
Yes, that looks good so far if you want to start the slideshow.
Okay, great. So here we go. Okay, I'm going to, let me just borrow. Let's try it this way. Let me get Kathy. Let's do Kathy. Okay, how does that better? Okay, we are going to start now. And again, we're going to talk about Path to Seizure Freedom. I'm Jana Moore with the Epilepsy Support Network of Orange County, and we're the patient advocacy group that works on education, who we are. We work on education, and our mission is that we are committed to building a community of support to improve the lives of those affected by epilepsy through education programs and advocacy. And our vision, what we're working towards, our big picture is a seizure-free community. So just to give you a little intro about our organization, we work very closely with Epilepsy Awareness Day at Disneyland and EXPO, and know Brad, Candy, Sophie, and Jen. And we love this event, and we do anything possible to help promote it because we think it is truly one of the greatest programs to help individuals with epilepsy on so many levels. And we're in the same county, and we're practically right down the street from one another. So good things come out of Orange County, California. So who are we? We started Epilepsy Support Network. Let me go back a little bit. We started Epilepsy Support Network of Orange County because parents were frustrated with the inability to stop our children's seizures and just heartbroken over the side effects of cognitive decline, developmental delay, etc. So what we did is we started with a few programs, and now we have 30 programs, and these are some of our programs. As you can see, we have upper left-hand quarter. This is our teen and young adult group. They meet weekly and go on outings. This is our Friday Friends Club. When we meet in person, we're on all virtual programs right now, except for our teens and young adults are meeting. And we have a wonderful walk in April. We do seizure recognition and first aid presentations. That's middle right. We have advocacy, bottom left-hand corner. And during Epilepsy Awareness Month, our signature event is Talk to the Doc. And when we're in person, this is how many people we pull together for our signature program, which is Friday of this week if you're interested in joining us. We do it all on behalf of individuals with epilepsy. So we have some goals for this presentation for all of you, and this is going to get you to seizure freedom. We want to help you gain a basic understanding of epilepsy, seizures, and the effect that seizures have on the brain. And to do this, it's really great if you join an advocacy group in your area. And if you don't have an advocacy group in area, you can put it in the chat and we'll talk about it. All questions, all comments, all help, please go ahead and throw it up in the chat and we'll all get to share it. One of the most important things I feel in dealing with epilepsy is the urgency for epilepsy. And let's say 24 years ago when my daughter was diagnosed, there was no urgency. So we let important milestones and important things go by because no one was telling us about the urgency. And what we have learned is there's a tremendous urgency to get seizure control. One of the key goals and objectives is to locate a level 4 epilepsy center in your area. And if there isn't one in your area, we can help you find the closest one to you. You also need to know your exact seizure type, seizure syndrome, or seizure types, plural. Um, then, with knowing the seizure types and getting to a level 4 epilepsy center, getting an accurate diagnosis, because getting an accurate diagnosis is how they're going to best choose the treatment options. So there is a you know, a really a strategic plan on how to do all of this. And when you choose the best treatment options based on your accurate diagnosis, that's when you see things improving. Um, and all of these things are going to help us reduce and eliminate seizures and side effects. And that's our goal. Okay? So let's start with the basics. What is a seizure? A brief, abnormal, excessive, or robust discharge of electrical activity in the brain that alters one or more of the following: awareness, sensation, actions, and movements. And what we have found in many cases that there are seizures occur, the smaller seizure types like absence or simple, partial, now known as um, focal aware, occur before you see a tonic-clonic. So seizures could have started earlier in life and they have not been noticed and they have not been treated. So epilepsy is very complex. It involves all parts of your lives, and we want to have a really good understanding of how the epilepsy started and its progression. Okay, the other thing we need to know is exactly what epilepsy is. It's a neurological condition where the main symptom is a seizure. 2 or more unprovoked seizures is epilepsy. You know, it's primarily a pediatric condition lasting into adulthood. 1 in 50 children ages newborn to 18 years will be diagnosed. 1 in 100 adults will be or have been diagnosed, and 1 in 26 people will be diagnosed with epilepsy. And it's more common than cerebral palsy, Parkinson's, and multiple sclerosis combined. And if you know 26 people, then at least one of those 26 people have epilepsy. We have not made the progress we should have made because epilepsy has been it has been affiliated and associated with stigma, discrimination, and a lot of people 1 generation ago did not talk about their epilepsy. But we're changing all of that. We're bringing epilepsy to the forefront. We're talking about it. We're raising awareness, just like this Awareness Month and this awareness event. Epilepsy is going to be a commonly spoke of condition like cancer and autism and mental health and all the others. And all of us play a role in that. And I want to make sure that during Epilepsy Awareness Month, you're wearing your ribbons, you're wearing your purple, you're talking about it, and you're getting the word out there so all of us can move forward together. That's so important for advocacy because we're not going to make progress unless we have advocacy. Okay, now that we know what epilepsy is, and I don't know the level of understanding and education that everyone has about epilepsy, but again, put it in the chat if you have any questions. Okay, now we're going to go to something that we created, big picture approach to epilepsy, folks. Okay, so let's take a look at the big picture of epilepsy. I know this can be frightening, but if you are aware of everything that epilepsy affects, then you'll have a better understanding and you'll put the pieces together quicker. And we here at Epilepsy Support Network of Orange County, as well as Epilepsy Awareness Day at Disneyland, we want to jettison you through this so you get the best outcomes as quickly as possible. If you're having a difficult time getting seizure control, and let's start with medical because that's what everyone starts with, the big pink circle there. Medical. And what we do is we share all of these, this is a Venn diagram, so all of these areas with our members so they can work on all areas at once. But most families, they want to focus on medical, and absolutely, because epilepsy is a dangerous and chronic um, medical condition that needs attention right away. So we'll start with medical, and you can see we advise people to, when they call in for an intake, we inform them that they need to schedule a consult with an epilepsy specialist, usually at an epilepsy center, get to know your seizure type, identify triggers, and then we refer them to our programs that help expedite them through this process, okay? And we know that epilepsy is going to have impact on learning, which is to the left, and memory. And we also know that it can have impact on social relationships and social awareness. So the longer it takes to get the epilepsy under control, then you're going to see more issues arise because of the underlying condition or the seizures themselves. So this is our big picture Venn diagram. We start with medical, okay? And then parents are most concerned with education and learning. So as we're trying to get seizures under control, we help families with understanding educational issues, cognitive issues, and we help them with IEPs and 504 plans, etc. And then parents might start noticing that children, their friends group might be shrinking because of cognitive or maybe some mental health concerns because of epilepsy. So we can work on that as well, give referrals, get them assessments through their epilepsy center or their school district, and also work on mental health, because we know there are so many comorbidities with epilepsy, like anxiety and depression, maybe feelings of isolation. So we plug our families into programs that help with all of these. So I just wanted to give you a big picture of epilepsy so you can see that it's just not isolated cleanly in this medical Venn diagram. It reaches other and most other components of life. Okay, so urgency. We want to talk about the urgency of epilepsy because there's a huge misunderstanding of the urgency of epilepsy. So with the disease campaigns out there, I think you'll be surprised to know that about 50,000 people a year die in the US each year from epilepsy. Now, 3 things that will help you. Getting in contact with an epilepsy advocacy organization like ours, where we keep you updated on the latest information, the greatest information, connect you to events like Epilepsy Awareness Expo so that you stay informed and educated, really helps to safeguard amongst the biggest pitfalls of epilepsy. So we want you to stay informed and we want you to stay connected, okay? But we can really reduce that 50,000 number just by stopping and preventing seizures. And that's why there's the urgency. This is the biggest point of our urgency. And when you look at other awareness campaigns, you would probably think that breast cancer, there are more deaths because of the tremendous amount of effort and money spent on the awareness campaign. But epilepsy, we're experiencing more deaths in epilepsy. If you look at prescription overdose, I'm sure everyone's heard of that, and yet we have more deaths as well. Skin cancer, drunk driving. And I know that great strides have been made in all of these, and we can make those strides in epilepsy if we work together by all moving forward together. And so that's my soapbox presentation on joining organizations and being a part of awareness and education and moving people from isolation to empowerment, getting them to awareness events like this one so they can learn all about the condition. And again, this goes under urgency, why we're doing the things that we do. Okay, so let's get into the nuts and bolts, meats and potatoes. This is what's going to make the biggest difference in getting seizure control. And our organization has over 2,000 members. So we've helped over 2,000 families help reduce their seizures, get seizure control, get to the treatment, get to the diagnosis, then the treatment. And we're very successful at that. And so we have great experience on how to make this happen. So diagnosing epilepsy is so very important, and to get a good diagnosis. And what happens is someone has maybe an unidentifiable or a seizure-like event or an episode. Not all seizures are convulsive. So how do you put your finger on it if it's an absence or if it's a focal aware, if it is a myoclonic jerk? Not everyone is going to recognize that. Infantile spasm, not everyone's going to recognize that. We will show seizure types at the end of this presentation, so you have a better understanding of different seizure types to help identify your seizure type. But this is what our families report, is there was something off or inconsistent with their normal behavior, but they couldn't put their finger on it, so there was no urgency. So we need to work together at educating our communities, our schools, etc., on what common seizures look like, so they can get the best possible and expeditious care, so there is no delay. The sooner you identify a seizure, the earlier you start treatment, the quicker you can get seizure control. So many people, if they have a tonic-clonic seizure or they can't figure out what it is, they'll go to the emergency room, or they'll call their primary care physician, or they'll get to a community neurologist. But what is the name of the specialist, the highest level, the best trained, the smartest specialist that works with epilepsy patients? I hear you all saying it. It's an epileptologist. So yes, so an epileptologist is trained 2 to 3 more years in reading EEGs, in treating complex syndromes and genetic epilepsies, and the focal epilepsies that are going to possibly require surgery. So where can they be found? Well, epileptologists can be found at comprehensive epilepsy centers. And there is a association of epilepsy centers that you can look up and find epilepsy centers in your area. And Brad and Candy have conveniently put a map of the epilepsy centers on their site, so you can look at those epilepsy centers and see which ones are closest to you for treatment. Or you can travel, talk to your insurance company. Maybe you can travel to an epilepsy center if you have medically refractory epilepsy. So comprehensive epilepsy centers are a one-stop shopping place for epilepsy. They have epileptologists, they have neurologists, they have epilepsy-specific nurses, social workers, neurosurgeons. They have it all for epilepsy care. And the highest level of an epilepsy center is a level 4 epilepsy center. They go above and beyond to treat the refractory epilepsies. They do sleep studies, they do genetic, metabolic, and mitochondrial testing. And so they can do many things with expedited care and through an expedited process. And just to give you an idea of how we work with our families in Orange County, California, is we know all the epilepsy centers, we know all the directors of the epilepsy centers, and we work very closely with them so that we know their policies and procedures, so we can work with them in referring patients. So we have a children's pediatric level 4 epilepsy center. We have 2 adult level 4 epilepsy centers, an up-and-coming epilepsy center that's new, that will increase their level. And then we also have a clinic that helps epilepsy patients that are adult that do not have insurance. So we are working very hard to get all of our members to epilepsy centers, working with their insurance um, and working with their primary care physicians to get them referred to epilepsy centers, because we know that's where their difficult to control epilepsies will have the best chance of getting an accurate diagnosis and then the cutting edge treatments that are available. And this is what we are really good at. Okay, so we're going back to diagnosis. So everyone, I want you to repeat after me. Diagnosis, diagnosis, diagnosis. You need an accurate diagnosis. And where do you get an accurate diagnosis? At an epilepsy center. Because an accurate diagnosis is going to lead you to the most effective treatments. And sometimes an accurate diagnosis requires genetic testing. That has to be expeditiously done. Long-term EEGs, 3, 4, maybe 5 days, maybe ambulatory monitoring to get 3 or 4 of the seizures that will lead to a diagnosis. And then once you have your diagnosis, then we go to treatment, to the best possible treatments. And there's medication, surgical evaluations. If you have a focal epilepsy that is medication resistant, it is not the last option. Surgery is never the last option. What you want to look at is if you fail 2 medications, then maybe a surgical evaluation, that process needs to begin. And then there are also diets and many other treatment options. We can't get into all of them, but it is always based on accurate diagnosis with a full and comprehensive diagnostic process. Okay, now surgery includes your traditional surgery, which is a resection of the area that is not functioning right, is diseased, has been damaged. But there are many new surgical options. There are implantable devices, VNS, DBS, RNS, and there's laser ablation, as well as other surgical procedures that are sometimes curative and sometimes palliative. So there are many surgical presentations today and tomorrow for your information provided by the EXPO that I would say please tune into. But what we like to do is we like to let our members know the options, and we do this through our presentations. We do seizure recognition and first aid. We do Epilepsy 101. We go out to other nonprofit schools, etc., and we talk to them about epilepsy, informing them that it's a new day for epilepsy. There are new treatments. We don't want anyone just languishing and not getting the best possible assessments, the best possible diagnostics, the best possible treatments. We want to move everyone forward because, like we've said before, there's an urgency. Okay, let's talk about the most common causes of epilepsy. Well, when I started, like I said, 23 years ago, they only knew of 30% of the causes of epilepsy, and that was because they were identifiable brain anomalies because of MRIs and imaging, brain imaging. And when they were doing brain imaging, so they can actually, the doctors could actually see maybe there's an anomaly like trauma, lesion, tumor, damage, congenital malformation, hypoxia, vascular issues. There could have been infections to the brain like meningitis, encephalitis, measles, high fever can cause damage to the brain. Maybe there was a brain injury at birth, a brain bleed. Maybe there was abnormal brain development, cortical dysplasia. Maybe there was damage because of a lead, neurotoxin, chemical, or gas. But through brain imaging, doctors were looking for this 30%. And that was always, I leave it here on the top of my presentation to remind people where we have come in 20 years. If you have a child or loved one with epilepsy and you have other members in your family with epilepsy, or other members in your family that have had seizures, maybe they don't have epilepsy, maybe they've had one or two seizures in their life, you kind of lean towards genetics. But genetics have to be proven. You just can't say it's genetic. It has to be scientifically proven. And with all the genetic testing that's now available, we are learning that up to 70% of people with epilepsy, um, it used to be called unknown epilepsy, idiopathic, cryptogenic, or theoretical diagnoses. But now, with genetics making such an impact on epilepsy, most epilepsy centers are doing genetic testing, especially in the very young children, because it is often found 0 to 2 with refractory epilepsy. It could be a genetic epilepsy. And so this is really important to take a look at genetic epilepsies, which also include metabolic and mitochondrial. So if you take this 70% and 30%, we have made tremendous gains on the common causes of epilepsy. And that is really an amazing feat that we've done by all working together and pushing forward. Okay, so here's another very big question and topic, and something that's very, very important when we talk about epilepsy. And it's one that families have the most control over, besides all the other things we've talked about. Now, we've talked about getting to an epilepsy center, learning as much as possible about your seizure type. And how do you do that? Well, you get a good diagnosis, you learn about the seizure type, and if it's a syndrome, you learn about seizure type syndrome, and you kind of focus on that diagnosis. You don't have to look at every single type of epilepsy. Focus on your individual seizure type and diagnosis. Then you get your treatment, and you follow the treatment protocol, and then you start to look for seizure triggers. What is the common denomination that causes your child or your teen, your young adult, or your significant other to have seizures? These are the most common, and it's important to report that to your doctor, what you identify as seizure trigger. So you can use Seizure Tracker, or you can write it down on a calendar, and you go back a day or two and say, what could possibly have caused this seizure? And once you identify the seizure triggers, you can begin eliminating them to improve seizure control. And that's what we want to do. We want to improve seizure control and stop the seizures, because we learned about the urgency. So for adults, missed or late medication. Usually adults don't have parents shadowing them saying, did you take your medication? Did you take your medication? It's important for adults to have timers and alarms to remind them to take their medication. And I suggest to everyone to have the medication cases AM and PM. And so you can just look at your case and you can say, did I take my medication? And if the medication is still there, then you haven't taken it. So use as many supportive devices or tools that you can for reminders to take your medication. The next two are very big for the pediatric and adult population: sleep deprivation and fatigue. You may need more sleep if you have epilepsy, and you have to plan for that. So you need to be able to go to sleep earlier and sleep in a little bit later. And this is especially true for children as well. They may need more sleep, and becoming more fatigued. They may need to even increase their sleep, because sleep deprivation and being overly fatigued can cause a seizure. And this is controllable in most situations. So parents, I know that especially in Southern California, you're getting invitations, there are fun things to do. We have beaches, we have Disneyland, we have everything. but you really have to hold tight to those parameters for sleep, because if it means seizure freedom, then it's definitely worth doing. Illness. Okay, and this is especially for the youngsters that are going to school. I think everyone's illness is down now because of COVID, and that's wonderful. But many really, bad colds and bad flus and bad illnesses will increase seizures. Now, we haven't seen that with COVID, which, knock on wood, that's wonderful. But I want to caution parents about that. So if, you babysit for someone and that kid has a flu, you're going to have to stand very firm on no illnesses around your kids that are trying to get seizure free, because if they have made it to the 6-month mark or the 1-year mark and you're teetering on seizure freedom, some doctors take a look at seizure freedom after a year, some after 2 years, and say, is it time to do an EEG and maybe consider weaning off medication? Because you never do that without the doctor's permission and those EEG studies, okay? And so if you're that close to seizure freedom and normal brain waves and normal brain activity have taken back over, and maybe this is your exit out of epilepsy, you don't want that to be threatened by an illness or a provoked seizure that we could control. So think about that and keep very sick people away, because sometimes those things can trigger seizures. Now we're going to talk about overheating, overexertion, and dehydration. I call these the built-in seizure triggers for Southern California. We're always walking around overheated, overexerted, and dehydrated. So keep your family members hydrated. Your child or young adult with epilepsy, overexertion, sometimes they're in sports. It can be easy for kids to overexert. I mean, that's kind of their developmental lifestyle, to push the limit. And also overheating. So you want to just keep an eye on these things and limit them as much as possible. The next one is a little more challenging. So stress and anxiety. Just having the diagnosis of epilepsy can be very stressful for kiddos. So what we want to do is we want to try to minimize the stress and anxiety. And I tell parents, you're going to have to bear that burden. And once everything is settled and seizure control has been maybe getting better, there's always that time for introducing independent living skills and taking responsibility for taking medications, etc. But the anxiety from epilepsy, the parents are going to have to burden that, because we want to try to relieve as much anxiety as possible from kiddos, teens, young adults with epilepsy, because it can trigger a seizure. Now, some triggers will be during finals exams, during finals weeks, during testing. And if you notice that, then you can ask your school for modifications, for more testing time, etc. If you can identify the seizures, that means asking a lot of questions, looking at what happened before the seizure. And if you notice that stress and anxiety, a buildup of stress and anxiety will cause a seizure, then what you are going to want to do is intervene. You're going to notice and have a behavior modification there to make sure that you reduce the stress and anxiety so it doesn't result in a seizure. And I know that's more easily said than done, but it is a management. Epilepsy requires a lot of management, and we know that stress and anxiety for young adults and kids and adults is a seizure trigger. For women, hormonal changes starts to happen about a year before they start their menses, and it can be a monthly problem called catamenial epilepsy. So you'll want, if you notice that, you'll be tracking seizures, and you'll find that once a month right before the period, and as the period ends, seizures will increase. And if it is hormonal, then you'll want to talk to your epilepsy specialist about how to address that. It's important to know. And you'll only know this if you do track it. because that's a trigger, and it's an important trigger. And over 50% of women do suffer from some type of hormonal catamenial epilepsy. So it's very important to monitor. Okay, for those of you who don't have good seizure control, you might find that missing meals, becoming hypoglycemic, and also maybe too much sugar or too much caffeine, dietary triggers can cause epilepsy. Okay, so watch for that. And usually, once you get an accurate diagnosis and better control with a better treatment, then you may be able to go back to having maybe a little bit of caffeine. Adults want to have a cup of coffee, and they should be able to have that without having a seizure. So that's a discussion you have with your doctor. And once you get a good medication regime, then issues like hypoglycemia and even dehydration, missed meals shouldn't be causing seizures. But some people will continue to have triggers like this. And so what you want to do is monitor them, and then you adapt, and then you manage it. So kids will always have to have breakfast and maybe a snack 2.5 hours later, and then lunch and maybe a snack 2.5 later, because kids have very high metabolic rates. And if you talk to your doctor about, maybe a modified Atkins or something to help them with their seizure control. We want to look at everything, and we want to have all options for our path to seizure control. If your child has absent seizures, then you have to be very careful about hyperventilation. And then there's the photic epilepsies with flashing lights. These are specific seizure types, but if you notice that, you'll want to bring that to the attention of your doctor. And if your doctor has given you a diagnosis, they may warn you about hyperventilation and flashing lights, that they can trigger seizures. So again, that's just monitoring your kids and adults with epilepsy, and making sure that they're not going to be getting into any situations where there's hyperventilation and flashing lights. And flashing lights, you can just cover your eyes or wear sunglasses, and not enter concerts or activities that do have the very bright flashing lights. Now, drug interactions. Your epilepsy specialist, you should always ask them about getting any other medications and what medications are okay. Some people, like my daughter, anything can affect her and her seizure control. So we're always asking about antibiotics and, any pain medication, because, kids have broken bones, kids get sick with other things, and you want to be able to treat them, but you want to be able to treat them effectively without causing seizures. So these are all things to keep in mind. Also keep in mind that if you are on a brand name medication, and because of insurance or availability, you cannot get the brand name and you have to switch to generic. If you have seizure breakthroughs, you need to report that to your epilepsy specialist, and that would be an argument for staying on a brand name. So that's very important if you're not aware of that these things can happen. So these are the most common seizure triggers, and managing them, it takes a little while to get into the routine, but once you identify the triggers for the seizure, now, not everyone is going to have all of these triggers, but most everyone will have 1 or 2 triggers, and find out what the trigger is so that you can manage it and help guide your loved one towards improved seizure control. Okay, this is for adolescents and adults. Alcohol, marijuana, recreational drugs could be a provoker or a trigger for seizures. And then also, withdrawal from alcohol can cause seizures. We know that. There is an FDA-approved medication that is from it's a cannabidiol, But regular marijuana, people are confusing this with medical marijuana. Well, the only marijuana that has been approved for epilepsy is a cannabidiol, and it is the made from Greenwich, and it's Epidiolex. So that is the only FDA approved. You want to stay with FDA approved, and marijuana can be, and oftentimes is, a proconvulsant. So make sure your teens and your young adults know that, because we all know that teens and young adults are going to experiment with alcohol and sometimes marijuana. And the other thing that you need to know about teens and young adults is at some point, and I would say 99% do this, they're going to try to reduce their medication or stop their medication to see if they really need it. And that's their role of becoming an adult, to take charge of their care and to, test the limits, etc. But when it comes to epilepsy and epilepsy medications, they really need to know that that option could cause seizures, and especially if they're driving, you really need to have that conversation with them, because so many parents have reported to us, and working with teens, we have a teen group and we have a young adult group. So many of them have tried to reduce their medications on their own, and it has resulted into breakthrough seizures. That's a delay in getting their driver's license, or if they have a driver's license, then they'll have their driver's license canceled. So open communication and just monitoring this condition can be very, very helpful in this area. So you probably all experienced, and here's another urgency about why we want to get seizures under control. It causes, seizures can cause short-term memory problems as well as the medication. Slower processing, this is about learning and cognitive abilities and trying to find a job and just trying to cope with a frenetic lifestyle with a lot of technology. It's no wonder that our kids and adults with epilepsy are having issues. So we have interictal activity. So what you don't see happening is what we call subclinical spikes. Is there's electrical activity between seizures, and it can be called electrographic activity, interictal spikes, or spikes during an EEG that aren't long enough to be seizures, but they're happening. So you always want to have the EEG get EEGs. Maybe your doctor will schedule them once a year if you have seizure control. But if things start to get problematic in these areas, go in for an EEG and see if there's electrical activity going on between seizures or interictal activity, because maybe your child has gained 10 pounds or 15 pounds over the summer, and maybe they need more medication, because it's micrograms per kilogram where you need to keep up with the weight of the child because of the blood levels. Okay, if there's more drowsiness, inattention, concentration issues, impulsivity, they're just not being themselves, behavioral changes, if you don't get seizures under control, we see delayed social development. That's very rough on kids. You want to get them into social groups, you want to get them into social skills groups, or you want to have social groups that you're connecting them with on a regular basis, so they're continuously practicing their social skills and they don't get more delayed. Many parents say, I'm going to pull them out of school because the school doesn't know how to deal with epilepsy. Well, there's seizure recognition and first aid for schools. We offer that through our organization. We need them to be in school because they miss out so much on social development, appropriate social development, neurotypical social development. And so we advise against that. Keep them in school, keep them social, keep them active with after-school activities, keep them active with sports, scouting programs, boys and girls clubs, all of those things where they're going to be constantly interacting with neurotypical kids who will be constantly teaching them neurotypical development. one of the big things that we want to keep in mind is we're always forecasting out 5, 10, 15, 20 years. And of course, we want to get seizure control right away because of all these issues. And we saw the Venn diagram. Seizures that continue will cause cognitive delays, and it'll reach into every aspect. And I say it permeates and flows into every aspect of one's life. And the quicker you get seizure control, the less permeation you have. But what kids really care about is they care about friends, they care about having a social life, and they really care about getting a driver's license. So at 16, they can get a driver's license. So if they're seizure free by 14, I don't know, different states have different rules, but our California Penal Code, I think you're reported at 14 if you're still having seizures to the health department. Health department alerts the DMV, and you have to be seizure free for 6 months. Most parents I know want seizure freedom for a year before their kid gets behind a wheel. Getting behind the wheel is tough enough. Getting behind the wheel with a history of seizures is sometimes just overwhelming for parents. So we start looking at those things and we start having conversations with parents way before that time. And at 16, getting a driver's license is a huge deal. But at 18 and 19, going off to college is even a bigger deal because they're not always under your supervision and your prompting to take medication. How are they looking? Are they eating right? Are they being healthy, etc.? So in our teen club, in our young adult group, we start teaching independent living skills so that it's an accumulation of skills, self-care skills, so that they can be neurotypical and go off to college if they want to, if they are seizure free. But it is a lot of monitoring, a lot of, I call it neurological coordinating for the family, but it can be done. And we do that by connecting parents with successful parents and then constantly educating yourself, like at this event today, where there are plenty of great presentations on cognitive development and epilepsy. So we're always looking out for social development. We have programs in social development and making sure that you can use that ability to get a driver's license as a lever to keep those kids on medication. And sometimes you need to. You want them to do it on their own, but sometimes you need an incentive. And if you're a parent of a child or young adult with epilepsy, I'm sure you agree. Yes, there are dual diagnoses: epilepsy and autism, epilepsy and cerebral palsy, epilepsy and Down syndrome. People ask that question all the time. And just because you have one neurological diagnosis doesn't mean you're not going to have another one. Okay, before I get into the seizure types, I'm going to check the chat section because it's hard to do that when you're doing the presentation. And I'm going to look at, I think maybe I'm going to go to the one. Oh, Alexis. Hi, Alexis. ESNOC is awesome. They've done a lot to help me. Alexis, you have done a lot to help us, and we really appreciate you. And thanks for being a part of our organization. Oklahoma wants to know if they have an epilepsy center. We're going to have to check the map. Jana, I'm located in Orange County and most definitely want to become part of ESNOC. Okay, Monica, go to our website, esnoc.org. Click on Stay Connected or get our emails. Put your name and information in there. It'll sign you up and we'll give you a call. That's how easy it is. For anyone that wants to be involved in our programs, go to our website, esnoc.org, and then click on the link at the bottom of the page, fill out your information, and we will get in touch with you, and we will keep you informed on events like this because that's what we do. Okay, I have a question about SIDEP. Yes, SIDEP is a horrible comorbidity of epilepsy, and I'm so sorry that your son passed of SIDEP, and we need to talk more about this. We need to talk about everything. I absolutely agree with you. SIDEP is sudden unexpected death in epilepsy patients, and it mainly happens with individuals who have tonic-clonic seizures in sleep. And if anyone calls us and we do an intake and they're having tonic-clonic seizures during sleep, then that's an expedited intake for an epilepsy center, and we spend a lot of time talking to parents. Now, 20 years ago, we were just beginning to hear about SUDEP. Now we all know about SUDEP, and it's, I shouldn't say all, maybe some community neurologists don't tell their patients, but that's the benefit of working with epilepsy centers, is they are all aware of that, and we need to move people forward. And our organization, if you don't hear to my voice, we have a huge urgency about getting seizure control, and SUDEP is one of those reasons. So thank you, Stephen, for sharing that. Let's see. Alexis says she was a student. She noticed that stress from assignments and finals was a bad trigger. Yes, Alexis. Women have it a little harder with triggers because they have that monthly trigger, and then you add stress from a final, and then the stress and anxiety causes you to catch a cold or something, that during that same time you have 3 triggers. Some people just need 1 trigger to have a seizure, some need 3, some need 5, but some can be brewing that you don't know. So you're gonna have to eliminate as many triggers as possible. Okay, so let's talk about seizure types. This will be helpful in getting seizures under control. Focal seizures happen in a focal point of your brain. Generalized seizures involve both hemispheres at the same time. And focal seizures, if it is truly a focal seizure due to an injury or an insult in the brain, you may have an option of brain surgery as a treatment. Usually generalized seizures, and we're just talking about the common generalized epilepsies, they don't have that option. So with focal, it's, positive and negative. People don't generally want to have brain surgery, but if you can't get your seizures under control, it's a nice option to have. Many of our members have had brain surgeries, and they have had positive outcome. And one of our adults in our group, in 8 minutes, will be going into brain surgery, and we are instrumental in helping our members get surgery because it can mean seizure freedom. Okay, so we're moving on. Oh, and seizures generally, let me go back. Most seizures last from 30 seconds to 1.5 minutes. So I know it can be frightening for that time, but generally they do last that length of time. If it's over 5 minutes, then you're going to need an emergency medication, and you need to talk to your doctor about that. So focal seizures start in a small area, and the difference between focal seizures is sometimes people have an awareness, or they'll have a sensation that they feel, the same type of sensation that they feel. Sometimes people call it an aura, but it is actually the beginning of a seizure. And if they feel the beginning of the seizure, or the strange smell, or a strange taste, or a strange sensation, that can be an indication that they're going to have a seizure. If they're feeling those things, we need to expedite this to get them to a specialist, because we don't want it to turn into a generalized seizures. And focal seizures can turn into generalized seizures, just like absent seizures are associated with generalized seizure. They're in the same seizure family. And so just because the seizures start out small, it doesn't mean they're going to stay that way. And it doesn't mean you have the luxury of time to deal with it. We want to expedite it as soon as possible. Because once you've had a generalized tonic-clonic or a convulsive seizure, then you have the pathway to always have a generalized tonic-clonic. It's a more serious seizure type. And again, we talked about SUDEP, and you have more injuries with convulsive tonic-clonic seizure. So what we want to do is we want to minimize the seizure. And if you're having focal seizures, we want to try to keep it in that focal vicinity and really eliminate the seizure type with medication. Now, focal seizures are progressive, so they may continue to progress, or they may, best case scenario generally is you get focal seizures under control for 4 or 5 years, and then they want to come back. And then you really have to take a look at
Lovely.
surgery,
Open
because
them
once
up.
they come back, they're very difficult to control. And all of this is presented in our seizure recognition and first aid and our Epilepsy 101, which we have monthly that you're welcome to tune into if you sign up on our website. So this is the difference between focal and generalized seizures. And focal seizures, this is just a short list of focal seizures and a short list of generalized. If you have absence, atypical absence, atonic, tonic, clonic, tonic-clonic, myoclonic, myoclonic absence, febrile seizures, benign neonatal convulsions, early myoclonic encephalopathy. These are just some examples of generalized seizure types. This is a child, a baby that has infantile spasms. So we're going to show you some seizure types very quickly. And we just received a grant about infantile spasms, so we want to get the word out there. This is one of the most common seizure types that's overlooked. So let's see if this will play for us. And I'm going to tell you, that's a seizure. That's a seizure. It's a quick jolt of electricity. It's called a spasm. That's a seizure. And first-time parents are uncertain what that is. It may look different in every baby. That's a seizure. And watch the head drop. And that's a seizure. So infantile spasms are very severe. They are an emergency. And if you notice in your infant or someone else's infantile spasms, then what you want to do is you want to
infantile spasms.
go
These
straight
typically
to the
begin around
emergency
6
room
months to 2 years of
with
age,
this,
but can start as
because they have a 4 to 6 week. That was a spasm right there. They are very difficult to notice, but I just want to make sure you saw that's a little spasm. That's a spasm. I'm going to show you another one. And that's a spasm. So infantile spasms week's coming up. I don't have time to share all of them, but put your questions in the chat. I'll try to get to them. And I'm doing another presentation tomorrow. If you tune in and you remind me, we can go over more seizure types. We've run out of time. That's a good sign. We have 21 participants. I'm very happy about that. And let's see what the rest of the questions are. Yes, okay. Catamenial epilepsy, one parent reports that her daughter's on birth control. That's what they usually use for catamenial epilepsy, and it usually does work very well. Yes, there's urgency and seizure freedom. And I have someone's email here. Let's see. Okay, someone wants to, through a direct message, work together on getting the word out. So I want to thank all of you because I'm running out of time. I have 2 minutes. If you have any other questions, again, if you want to join our, these are more seizure types. If you want to join our organization, get on the mailing list. Oh, new epilepsy medications, Nasalam and Valtoco, intranasal for emergency seizures, for stopping seizures. Let's go to the take-home message. Seizures must be stopped as soon as possible. Seizures are harmful to the brain and normal development. Seizures can cause more seizures. Independence is severely compromised and commensurate with seizure frequency. More seizures, less independence. Epilepsy centers are the best hope for seizure control. We can help you get to one. We are here to help with all of these. Compassion drives our organization to urgently help children, teens, and adults find relief from seizures. And this is the fruit of our labor. All of these kiddos are seizure free. and we've had brain surgery, we have medication, brain surgery, and whatever it takes to get our kiddo seizure free, that's what we want to do. Here's our website, esnoc.org, our phone number, and if you need further help, I know Brad and Candy are here to help. We're here to help. So let's get together on this and together move forward for best possible seizure freedom and a pathway to seizure freedom. Thank you all very much. I'm presenting again tomorrow, so tune in tomorrow and we'll talk more about epilepsy. Have a great Epilepsy Awareness Month. Wear your purple, tell your stories, shout it out, and enjoy Epilepsy Awareness Expo. Thank you, everyone.